My name is Mahendra Shah, and it's my pleasure to introduce Dr. Daniel Kraft, who is a physician, practiced medicine for 20 years. He's a scientist. He has published in Nature and Science. He is an inventor. He has a number of patent filings and applications, and he is an entrepreneur. So he has started a number of companies. So it's my pleasure. I'd like to introduce Daniel Kraft, and thank you very much for taking your time to come here and share your experience.
Thanks, Mahendra. All right, thank you. See if I can get my technology to work. Thanks very much. It's an honor to be here. Thanks to Mahendra and the committee for inviting me. And it's nice to follow Andrew, who I think nicely set up some of the themes of what I'll speak about, as well as we sort of look into how we might disrupt the future of health and medicine in a variety of ways through healthcare IT and a number of fast-moving technologies. But I thought before we sort of dive into the future of medicine, it's sometimes helpful to take a look into back to the future. And after medical school here at Stanford, I had the chance to do my medical training both in internal medicine and pediatrics in Boston at Massachusetts General Hospital. And I was back there about 2 years ago for the 200th anniversary of MGH, a chance to have a reunion with the house staff that I trained with in Boston. This is before those little 80-hour work week restrictions. We could joke about walking uphill both ways in the snow. And I found myself, after one of the receptions in the old original building of MGH, at a famous spot of healthcare history called the Aether Dome. And it's called the Aether Dome because in 1846, this very patient was the first patient to get general anesthesia with his surgery. Before that, there was literally bite the bullet. I think this picture was taken before HIPAA laws. But if you go back to the Aether Dome today, it's just like it was in 1846, frozen in time, a shrine to medical history, just like it was back then. I wandered down the hall 3 minutes away to the ward where I spent my first month as a brand new intern in the mid-90s, and to my shock and dismay, that was still pretty much frozen in time, almost like 1846. Some of the same alarms were beeping, some of the same nurses, maybe some of the same patients. The only difference was the poor intern on call was pushing around a cart, had to type in an electronic medical record, print it out, put it in the paper chart, and they were still faxing orders back and forth to the pharmacy 2 levels below. And I thought, even at man's greatest hospital, MGH, we're still practicing medicine like 1846. And like, as Andrew experienced in his pediatric visit, medicine's still practiced in silos with old buckets, old definitions, old fiefdoms. And I think whether you're in biotech, IT, or beyond, we need to think outside of our normal realms of healthcare, including waiting for an hour in the waiting room for a 10-minute visit, as we're going to think about reshaping healthcare beyond the old definitions of body of bucket parts and specialties. And we're going to need to think differently about healthcare if we're going to address many of the huge challenges, the 18% of our GDP, the aging demographic. With Obamacare, we have a lot more covered Americans, but a huge shortage of primary care physicians and specialists in many parts of the country and the world. We have a lot of big data coming at us from our devices and sensors, but it's not necessarily actionable information. And a lot of that data is very fragmented, still in paper charts and electronic medical records that are still hard to use. And while technology is moving quickly, unlike maybe regular software and applications, we have the challenges of our friends at the FDA and our friends the payers, like Medicare and Blue Cross, who don't know how to often pay for this technology. 2 meta trends that are going to be shaping this tidal wave of innovation are 2 things. One, how do we pay for medicine today? Today, we don't practice health care, we practice sick care. We're on the right side of this equation. We incentivize doctors to see more patients, and it's incentive-based medicine, not reimbursement-based medicine, not necessarily evidence-based. Technology and the reimbursements are starting to shift things to the left to valuing outcomes and prevention. Another meta shift is where's healthcare happening? Traditionally in the hospital, in the clinic. Now that's happening to getting folks out of the hospital sooner or never letting them into the hospital, and technology is enabling that to come to our home and onto our own bodies. So those are 2 meta trends that are happening. And the overlapping theme here is that we're in a really fast-paced world, this exponential age. I came back to Stanford for fellowships in hematology, oncology, and bone marrow transplant 10 years ago. And that 10 years ago, if you've seen the Steve Jobs movie, that was 2001. He's waving around the first iPod. That was only 2001, and think how fast that world has moved. It's only been 6 years since the iPhone, 4 years since the iPad. And those technologies, our magic, Moore's Law in our pocket, is really impacting everything, including in healthcare. These are about 1 billion times faster and smarter than the best supercomputers in the 90s, and they are riding exponential waves. And that's at the exponential point, as opposed to linear thinking, where we have the opportunity to reshape, rethink, and disrupt many elements across the perspective. But it's hard to think exponentially. You want to be like Wayne Gretzky, go to where the puck is going. When we think exponentially, that's a little more challenging. But that's where things are heading, and it's not just in Moore's Law and IT, it's happening in big data and 3D printing and social networks and beyond. It's when you mash things up that things get the ability to reinvent things, including in healthcare. So a few examples, we've all lived in the last decade of what's been reinvented, how we read books. Amazon sells more ebooks than regular books today. We've disrupted Blockbuster's gone bust, right? We've changed the way we pay for things, the way we travel, the way we, if any of you have used Uber, they didn't invent anything. They didn't invent the phone or mobile or social payments or online mapping and GPS. They just layered it together. So the question, what will be the Uber for healthcare that reduces some of those frictions as we go downstream? And I think we're exemplifying the pace of change just from the inauguration of the Pope in 2005 versus the next one in 2013. You can see the technology realm, and that exemplifies the Kodak moment. Kodak actually invented digital photography, but didn't pay attention to the pace of exponentials, and they went bankrupt while essentially our friends at Instagram sold for $1 billion. So if you're not paying attention to exponentials, you can be the next, you don't want to be the next Kodak. The opportunity is to be the disruptor, not the disruptee. Okay. Let's look at some exponentials at play. Andrew mentioned the genome already, dropping at twice the rate of Moore's Law. It's about $1,000 today. How many folks have you ever been sequenced or had anything done like that, right? So now for about $99, I know 23andMe is in trouble. You can get 1.5 million base pairs analyzed. That's still very, very powerful for analyzing things like pharmacogenomics, how drugs affect what genes, and genes affect what drugs and doses you should take. We're moving to the age of the $1,000 genome, soon to be a $100 genome. The challenge is what happens when a patient comes to me with their genome on a disk drive like this? How do we make sense of that? How do we make it useful? And it's not just genomics that's getting cheaper. It's the proteome, thousands of biomarkers from a drop of blood. Environmental data, the idea of the exposome, where we've lived, where we live by a waste plant or in a rural farm, very different exposures. Clinical imagery data, biomarkers, the microbiome, the bugs in our gut, which you can now sequence through companies like uBiome, are providing insights into obesity and inflammatory bowel disease and beyond. So it's going well beyond the personalized and precision medicine. It's blending prevention, personalization, and now participation. We can start to share and integrate this data across different players. We're seeing exponential IT power the new imaging technologies, so we can see at high resolution and reconstruct that on our tablets and be much more personalized and targeted when we do interventions. We're seeing the ability to understand our brains in new ways, not just the amazing anatomy, but the connectome and how that applies to both normal cognition and psychiatric diseases, or elements like Alzheimer's. There's new ways to scan the brain and pick up Alzheimer's 10 or 20 years before symptoms occur. And there's even ways without scanning to use eye tracking with a simple $100 eye tracker and a laptop to diagnose Alzheimer's 10 or 20 years earlier. So if we can do that, maybe we can really play a role in preventing it from occurring or treating it at earlier stages. Some areas that will be disrupted will be traditional cardiologists, for example. The angiogram you're all aware of is now going to be disrupted by a Stanford spin-out called HeartFlow. They can do a 30-second CT scan of the heart, send it to the cloud, then the entire heart anatomy is reconstructed, including, is this blood vessel narrowed or not? How narrow? Do you need a stent or a bypass surgery? If you need a stent, how can you personalize that or maybe even 3D print it to mask that patient? So that's going to disrupt some of our friends in cardiology. A startup I advise out of Stanford as well called Morpheus can do a 10-minute cardiac MRI, completely reconstruct the anatomy and the heart function, and this I think will replace the cardiac echo in the next few years. Now, mobile, of course, is where healthcare is happening now. mHealth or digital health or connected health. This is what we had 10 years ago. Now we're clearly in the tablet era. Every medical student at Stanford now is getting an iPad with their first day of school. I went to Stanford. We had a textbook for 100 pounds. And many of you know in India, they're now selling the cheapest Android tablet on the planet for $35. So the implications for $35 tablets in both India and other parts of the world, and to give these away to your patients or part of clinical trials, I think will be particularly impactful. And they provide feedback loops. Whether you're diabetic and you want to record your blood sugar directly on your smartphone and now have a dashboard to your data, that's going to enable us much smarter ways of managing the data, being proactive, and improving outcomes, for example, in diabetes. And we're moving to this era where I'll prescribe an app to my diabetic patients or a pregnant patient or a pre or post-op patient. And Andrew mentioned ZocDoc, which is a great example of open table for healthcare, which I used for the first time about 3 months ago. I had a little benign lump on my neck. I didn't go see a dermatologist. I downloaded an app, sent it into a dermatologist. They made the diagnosis. I went onto ZocDoc, found a plastic surgeon in Palo Alto, made the appointment, didn't have to have a pre-op appointment, did it all on the phone, and had my surgery. Here's a little case study. Boom, much more efficient, all mediated by 2 apps and a single doctor visit. So we can make healthcare more engaging. Andrew mentioned being the CEO of your own health. If you're engaged in your healthcare, you can make it fun and engaging, whether it's through gaming or using off-the-shelf technologies like Microsoft Kinect for things like physical therapy, which aren't usually very fun to do, or take new technologies like the amazing Leap Motion, which you can imagine being hacked into the operating room or for physical therapy or other realms of controlling your environment. Lots of new ways to integrate healthcare as we move downstream. And it's not just vital signs that are getting digitized. It's other elements from iNetra, which is, I think, another coastal company. They can do eye diagnostics. You heard about the AliveCore company, which, because they do the EKG right on your phone, that I introduced Vinod to a couple years ago. That creates immense opportunity, not just for screening patients, for enabling a triage nurse or others to not only get the EKG on their phone, but now press a button and get the data and the analysis done right back to them as well, because most of us don't read EKGs. We're in this era of quantified self. How many folks here are wearing a Fitbit or something similar? A few of you, right? That's changed some of your behavior. I'm wearing 6 of them right now or so, right? And we're moving from quantified self to quantified health. These are technologies like the Basis watch, which I'm wearing, that was just bought by Intel a month ago for $110 million, that not only tells time, but also tracks calories and heart rate. It has a heart rate sensor. This is a consumer device today, but you can imagine where this could be prescribed to patients to track their heart rate data if they're on a beta blocker or others. And speaking of the wrist, this is going to be a very hot space in healthcare. We all know the rumored iWatch that is coming, and that's supposed to have a lot of health sensors in it, and the health book. So when the consumer can integrate this data and be connected to it, I think it's going to be very empowering and very interesting to watch. Connected blood pressure cuffs you can buy in the Apple store down the street can be used to make smarter decisions for hypertension. And we're seeing a whole slew of ways to measure wheezing for asthmatics, ways to tell when you've used your inhaler or not with connected GPS devices on your inhaler. We're seeing things for kids to track vital signs on their onesies. A lot of things are emerging in this space, all the way down to shrunken tattoos, digital tattoos, that can track your vital sign data. I'm actually wearing a patch from a local company called Vital Connect, a $2 disposable patch, right here in my chest, and I'll see if I can do the live demo. It's going to be streaming my live data through my phone right now to the web, and you can see my heart rate's only 110, my stress level's only 99%, thanks a lot. No problem. I have to talk fast here. It's talking to my phone and doing the EKG. There you go. You see my live EKG? Whoa. Any cardiologists here? If I run around, it's going to show my steps. If I fall down, it has posture, and it could call 911 if I don't stand back up, for example. So imagine how this will be used in patients with heart failure or folks who just want to optimize their exercise regimens, temperature, position, body, all that stuff coming together in an integrated patch. And we're not only going to wearables, we're moving to the world of insidables. This is the eye pill developed by Philips you can swallow and replaces an upper endoscopy. So going from wearables to insidables is going to be part of our future of technology and healthcare. And we're literally moving to this digital doctor's bag. All these technologies can take what used to require a clinic and can be moved into the world, whether it's blood pressure cuffs or glucometers, or now all the tools that you can use as individuals. And I'm always asked, Daniel, which one of these should I buy? So I co-founded a company a few months ago called Bionic Health. We haven't formally launched it yet, but it's one of our early components is the ability to compare and find all the connected health technologies, find out which ones are right for you, enable you to compare them, enable for physicians to prescribe them, and then get that data back and make it useful as we go downstream. Now, it's not just vital signs that are getting cheap and accessible. It's now laboratory data. Labs on a chip are enabling new ways of doing, from a single drop of blood, very low-cost analytics. Some of those are pretty simple tests, like the urinalysis. A company called Scanadu up the street has developed urinalysis on a dipstick. Sorry. Oops, I've somehow lost my... there we go. Dip the urine dipstick, take a picture with the app, have urinalysis done. Or influenza testing on a similar technology. This will enable you to do point-of-care diagnostics at home. And really brings us to this era of a digital checkup, where it's vital signs, lab data, and increasingly telemedicine, where for $10 you can have a 10-minute visit on one of like 5 different companies now who are doing telepresent visits. And my hope as a clinician is these technologies don't get in the way of our doctor-patient relationship, but can enhance them in powerful ways as we move forward. Now again, it's not any one technology. It's not just healthcare IT. It's mobile, it's sensors, it's big data, it's genomics. And there's new challenges with this technology. The new pacemakers are smaller and cheaper. They can be hacked. We might have heard about Dick Cheney having his pacemaker hacked. Could have been a good thing, right? You might have your insulin pump hacked as well in the future. Lots of challenges here. Also, who owns the data? My friend Hugo has a implantable defibrillator from Medtronic. They wouldn't give him his own data. Who owns the data from our bodies? Important questions as we move downstream. And for us poor clinicians and patients, how do we make sense of this avalanche of big data? Our brains haven't had upgrades, though our devices keep getting upgrades. So AI, technologies like IBM Watson are going to play an important role there. And I I don't agree with Vinod in thinking that 80% of doctors will be replaced. I think instead of AI, we'll have IA, intelligence augmentation. This is going to enhance our skills across the spectrum, and we're going to see AI play a critical role across healthcare. And in blending with science fiction, you all know, Star Trek, the tricorder. Tricorders are not really science fiction anymore. We have $100,000 ultrasounds that are now $2,000 fit in our pockets. We have an X Prize that I've been involved in designing to build medical tricorders, and there are now several companies involved in that. One is called Scanadu, which came out of the FutureMed program I chair. Hold the device to your forehead. It basically gives you your vital signs and more. It can be analyzed with IBM Watson type technology. And in fact, this company, interestingly, crowdsourced their clinical trial. $1.6 million, broke the record on Indiegogo. I have the first device right here. 10,000 of these will be shipping in the next few months. So powerful ways to fund new companies. Now with all these devices and sensors, you don't want to log into all the APIs. Where this is going to need to head is smart integration analytics, just like the check engine light in your car, or the OnStar for the body. I think we're going to move to the integration of this data in powerful ways as we move forward. And this is going to be part of our world of connected health, right? It's not just us as silos individuals. We're learning that the social network can be important in obesity, depression, changing behavior, because behavior is much more important than our genetics in terms of impacting outcome. Companies like Omada Health are now prescribe behavior change. They just raised $20 million for pre-diabetics. You can save a lot. If you spend $1,000 on turning someone around from turning diabetics, you'll save money downstream and improve outcomes. How about rewiring our brains? This new world of augmented reality. If you could see the future you in the mirror, if you really work out, or the future you if you keep having donuts for breakfast, right? And you don't need to wait for the virtual mirror. You can download Fatify, here's me now, here's me 1,000 donuts later, right? Or if you spend too much time, if people are smoking, you can show what their skin's going to look like. Or if they spend too much time on Facebook, right? So, so I think we'll see technologies like Oculus Rift, just bought by Facebook, play an important role in rewiring our brains as we go downstream. Robotics is playing a role. We can now do telepresent visits to our loved ones in the hospital. These things are getting cheaper and more available. I'm going to log in right now to a telepresent robot at Singularity University, where I chair the medicine track, and if it works here, I can move around a room here, and if there's someone there, they could talk to me. And this sort of technology is going to be really doesn't want to move right now, but really powerful across healthcare and other modalities. So robotics can be disruptive, whether it's robotic anesthesiologists, which the anesthesiologists are fighting tooth and nail, or robotics to enable the disabled, whether it's connecting brain-computer interfaces for the folks who have quadriplegia to control robotic elements. And we now have brain-computer interfaces that you can buy for $100 to help focus or do meditation, or learn to get kids off of their Ritalin because they can learn to focus. We're seeing robotics in the wearable space, exoskeletons that can now take a paraplegic and allow them to walk, and the new versions of these allow them to have 3D printed parts to match their own anatomy. So incredible ways to blend robotics and enabling the disabled. We want to not just cure the folks with spinal cord disability, we want to cure them. We're now in the world of induced pluripotent stem cells. This gentleman won the Nobel Prize a year and a half ago for being able to take your own skin cells, reprogram them. Skin cells and regenerative medicine biology is blending with 3D printing. We're now in the era of building 3D parts for the operating room, for neurosurgery, for making prosthetics, for orthopedics. I can 3D print a version of myself with a Microsoft Kinect for $5. That's kind of fun. It's called Mini-Me, right? And that might play a role if I have a patient who's missing part of their face from cancer, for example. So we're going to see 3D printing blending with stem cell biology and beyond. We're at the early stages of 3D printing our own advanced organs. So why am I talking to you as a physician and pediatric oncologist about technology? Well, I chair the medicine track just up the road at Singularity University. It's a 5-year-old institution. Please check out singularityU.org. We have 10-week summer programs and 1-week programs where we take today's and future leaders and help them understand the pace of technology, medicine, biotech, robotics, AI. We ask, how do we apply technology to affect big challenges like healthcare and poverty and education? For example, leveraging drones like this company has to deliver drugs and vaccines in the developing world, or making telepresent gloves to enable better exams. And I run a program each year on the future of medicine called FutureMed, or actually now called Exponential Medicine, where we bring folks across the spectrum. And you're all invited to come to our next program at the Hotel Del Coronado in San Diego, where we really look at many of the things I'm talking about really quickly in 3 or 4 days. And many new technologies have come out of that, and companies have come out of that, exponentialmedicine.com. All right. And that theme of exponential medicine at Singularity University, it needs new minds from different fields. It's not just the traditional physician or technologist. It's IT and robotics and app folks. Even Google is getting back into healthcare. It takes design thinking and new accelerators and incubators. The US government has opened up the data pipes. There's health hackathons happening on a regular basis. Rock Health up in San Francisco. Many successful healthcare IT companies have been born there. And they're integrating design thinking. You all know that, gotta talk fast. Apple didn't invent the laptop, but they used design thinking. And we need design thinking just like we've had in the flying world. And I like to use the example of flying to exemplify that, because we can take lessons from the design of flying. And I've been a pilot since college in Cessnas, and as a flight surgeon in the Air Force, flying in high-performance fighter jets. And a few examples from that world include checklists. We're now making hospitals more safe in various ways. Checklists are being critical. Simulation, we train our pilots, we're now training our physicians and nurses and others in smart ways, and how not just on doing procedures, but how to come together and be smart about integration. We're seeing examples of the cockpit is being exemplified in the clinical world. So the glass cockpit has now emerged, the heads-up display, the idea now that we can wear Google Glass and other technologies to bring the data to ourselves when we need it, just like in the fighter pilot world, is going to be incredibly important as we want to visualize this data, just like we do when we drive now, and it changes our behaviors. So imagine having a GPS for healthcare that says, Daniel, go right to the gym, not left to McDonald's. It's going to be part of the future, right? The last example, and I'm out of time, would be, besides Google Glass being a really important role, I think we're seeing a lot of innovation on glass, and this is a really important use case, and I think the key use case for Google Glass and by the way, medical students at UC Irvine just all got Google Glass last week. It's going to be very powerful. Last example I'll give will be radar. What if we can start to share data and crowdsource it and see it in new ways? Just like when you drive with Google Maps or Waze, you share a little privacy, but in exchange, and here's a map of Rome being built in a day, we're able to now get back driving instructions. Where's the best traffic routes, et cetera. So I think if we think into the future of healthcare and disruption, we'll realize we've been flying a little bit blind. Now we have these new tools, all these new omics, new sensors, big data, analytics. We can apply our social networks to know what neighborhoods things are happening in. So who do you shake hands with that day, for example, can come into role. We can apply new dashboards and new design thinking all around integrating healthcare, reinventing it. Many of you in the room have built incredible technologies, can apply that to healthcare and take us from where we've been, very episodic and reactive. We wait for the heart attack, the stroke, the lump. We get data once or twice a year, and move to a world that's much more continuous and proactive. And I'm hopeful that many of you will apply your skills, technologies, companies in doing just that, and realizing that the future of healthcare is not just being a blood and organ donor, but being a data donor, and that we can apply some of these exponential skills and thinking to realize that, just like with Google Glass, the future's not evenly distributed, but it's coming fast, and we have the opportunity not just to predict the future, but to go out there and to create it. So with that, I'll say thanks very much.